So I'm originally from New Zealand. I was born there and grew up there and went to medical school and started my clinical career at Auckland City Hospital. I always had an interest in research and using strong data and evidence to inform what we do with both our clinical work and also how we think about health systems. And so after having spent some time in New Zealand working clinically, I moved to the United Kingdom to pursue a PhD at the University of Cambridge. And while I was there, I met my husband, who's Canadian, which is how I came subsequently 5 or 6 years later to find myself in Toronto as a general surgical trainee.
Yeah, and you had done a lot of work with the Lancet Commission. And what is that, and what kind of work did you do?
So there has been a lot of interest in global surgery in the last 5 years in particular, I'd say. But initially, back in sort of 2011, 2012, when I was living in the United Kingdom, there was a small but dedicated group of surgeons who'd spent a long part of their career working in international health. And they spoke to several editors at the Lancet and said, this is a very neglected area within international health that deserves to be showcased and spotlighted in an international medical forum. And at that time, the Lancet was producing commissions where they were bringing together people from diverse backgrounds to try and address under-researched areas in more than a sort of 3,000 word article. And so at a conference in the UK in 2012, I think it was, the Lancet approached a group of British surgeons and asked if they would be interested in forming an international commission to try and document global surgical need, and particularly surgical need in low and middle income countries, where there was a lot of people doing very, very good work at a local level, but not a lot understood on a global scale in terms of what was needed.
And that led you to travel quite a bit in the different localities of the commission and of the people in England, right?
Yeah, so the commission brought together collaborators and partners from 110 different countries around the world over a 2-year period, which involved a lot of Skype conference calls at strange hours as we brought everyone together across different time zones. And it certainly reinforced to me that we live in a small world, really, after all. The commission had meetings in North America, but also in Freetown in Sierra Leone and in Dubai in the Middle East, as well as regional meetings which were conducted in India and South Africa, and as well as in the Oceania region.
And the commission came out with a publication in 2015, right? And continues its work, does it?
So the commission report sort of documented and identified areas of global need for surgical care and outlined strategies for addressing these at local, regional and international levels. And it also developed a set of 6 core global surgical indicators by which the world can monitor global progress in improving surgical care for those most in need. The commission itself is finished and wrapped up, and the work is now taken forward at the local, regional and international level by other groups working in these areas, whether they be policymakers, researchers or clinicians.
And what kind of work do you envision yourself doing in global surgery in the future?
So I think one of my biggest passions is how we can use data to better inform healthcare planning and healthcare service delivery. And so I'm very interested in understanding how we can develop surveillance methods in all of the countries in the world, not just in high-income countries, to better inform and react in real time as to where there is a need for different health services, including surgical care.
Most surgeons, and I'm sure you included, have a passion for actually doing the surgery. What do you think of that role with yourself?
So I think that there is a great need for training of surgeons in low and middle income countries, and certainly in the same way that we partner with other surgeons in high income countries to learn new approaches and new techniques, there is a role for training and education. I personally think that I can be of make a bigger contribution through upskilling at a research and policy level rather than providing clinical care, although I have a strong interest in training and how we train and educate surgeons around the world. So I think everyone has their own thoughts on what that role is.
Sure. And two words that you hear often are sustainability and accompaniment. What is your idea of sustainability in a country from the global surgical perspective?
So I think it depends where countries are at in terms of their social, economic, political and sort of health status in general. But certainly in middle-income countries, when we talk about sustainability, we're often referring to the ability of a country to pay for its own services for health and for surgery. And some of those are political decisions around how we spend money, but some of those pertain to commitments from global. Sorry, I've lost my trail of thought a little.
Okay.
Start from the top, I'll cut it together.
He can cut and paste
Yeah.
or whatever he does. So the sustainability, you talked about middle income countries.
Yeah, so maybe just so
Pay their
I
own
can
way.
talk. Maybe I'll just start the question again.
Okay. The two words accompaniment, used by Paul Farmer a
Yeah.
lot, and sustainability. What do those two words mean to you in terms of global surgery?
I think for me, sustainability in terms of global surgery means the ability for patients, clinicians, and countries to determine what they want and what they need, and to be able to prioritise and make choices about them in a way that doesn't reflect significant limitation on resources, but is more around need and priority at a country level. So I think sustainability means different things for countries at different stages of their development. Certainly in middle-income countries, many of these countries have gone through significant economic transitions, are in the position for the first time to think about how they fund their entire health system out of their own gross domestic product or national incomes, with less and less requirement for international development assistance. And that's really exciting for countries in that position to think about how they want to design a health system and surgical services. For low-income countries, there's probably a need for the foreseeable future for health funding and surgical funding to occur both from national or domestic sources and also through international development and assistance programs.
What role would a University of Toronto medical student or resident have in going on a global surgical mission?
So students and residents, I think, around the world have driven a lot of the university's interests in global health and also in global surgery. And I think there is a recognition in 2017 that as a result of technology and the ability to be a lot more interconnected, there is an understanding of our interdependence and also the scale of inequity globally, which students and residents are able to experience both locally in their own communities and internationally.
Do you think as a resident there are benefits to doing a rotation, let's say, on some project that's in global surgery? And what would those benefits be?
So I think if I reflect on my own experiences as a trainee, it's probably been the most humbling and meaningful times in my life have been working with other surgical trainees in low resource settings. I've spent a lot of my time in Freetown and in the surrounding areas in Sierra Leone working with surgeons there, and I'm always reminded of how thankful I am for a strong publicly funded health system in the country I grew up in and the country I'm now living in, and it often puts in perspective the challenges that we face as surgeons and surgical trainees in Canada are relatively small compared to what many trainees face just to be able to embark on and complete their training in countries such as Sierra Leone. For example, several trainees
The global surgery one has an idea that it's always international. Do you think global surgical principles pertain to Canada as well?
So I strongly believe that global doesn't mean countries outside of where we live, but that it means all of the countries and places around the world. And in fact, when we first defined what we thought global surgery meant in the Lancet back in 2014, we specifically emphasised that global surgery is about processes of surgical care that affect all of us globally, and about addressing inequity and disparities that is irrespective of geography. So I very, very strongly believe that global surgery is about understanding and addressing inequity within surgical care and surgical outcomes in all communities, whether that be in Toronto, whether that be in Ontario, whether that be in northern and Indigenous and rural communities in Canada, or whether that be in some of the poorest areas of the world like Sierra Leone.